Awesome. All right, so welcome everybody to the 5th, 6th, 7th, I can't remember the number specifically, in a series of Zoom webinar meetings that our presidents asked us to put together for everybody who works in student services. I'm Jake Farbman, the Executive Director of the Center for Student Success. And before we turn it over to our presenters, I'm just going to do a couple quick housekeeping things to make sure that we run this as smoothly as possible. So number one, because I'm sure many of you have done these Zoom meetings, have experienced some technical difficulties. If you're not one of our presenters, or if you're not presenting at a certain time, let's just do us a favor. Turn off your camera and mute your line. Mute your line, turn off your camera, just so that we save bandwidth and we don't cause any, issues for anybody. So that's number one. Number two, if you would be so kind, if you haven't done so already, please enter your name, college, and email address in the chat box. Why? Well, two reasons. One, we want to be able to share the recording of this with you once it's available. But two, our presenters have put together a resource guide to share with everybody. And I'm going to send that resource guide out to everyone upon the end of this webinar, so a little later on this afternoon. So if you'd like that resource guide, please enter your name, college, and email address in the chat. So that's one. That's two. If you have any questions throughout the presentation, feel free to enter them into the chat box. I'll monitor those, and when it comes time for Q&A, we'll float those questions to our presenters, and we'll have a conversation about those questions. And then finally, if time permits, for any of you see something along the way, and you say, oh, we're doing things a little differently at our school, or oh, we're doing things here that way. And if time permits, we can have a round robin and talk a little bit about other practices that you folks have incorporated at your institutions that might be helpful to our colleagues on the line or our colleagues who are going to watch this asynchronously. So with all of that, I'm going to turn my camera off and mute my line, and I am going to turn it over to Leah. So thank you all for being here this afternoon.
Hi, thank you so much, Jake. And thank you everyone for attending this workshop today. We're really, really happy to be doing it. So the title of the workshop is Holding Space in Uncertainty, Providing Mental Health and Social Wellness in this Unprecedented Time. So basically what we're going to talk about today is some methods and strategies that we at Passaic County Community College and Raritan Valley Community College have been using to meet the needs of our students during this unprecedented time. So thank you so much for being here with us, and we're really looking forward to sharing this information with everyone. I could probably hit next. So for starters, we're just going to introduce ourselves. I'll start with Passaic County Community College. Myself and Tina Rabaudo are here from Passaic County Community College, Office of Student Advocacy. And what the Office of Student Advocacy does is we provide connections to community resources and linkages to services for students within the community in the way of holistic well-being. So that could mean, social wellness resources, basic necessities, mental health. We even help them, if they are homeless or they're, at risk of becoming homeless. And the other thing that we help with is immediate behavioral health crises, the appropriate handling of those, and then assisting the student in, their next steps towards stabilization. We do some short-term solution-focused counseling with appropriate community referrals, and really work to develop like a treatment plan for the student so they can get what they need, meet their needs within the community, and events and programming related to all aspects of student wellness, and with a real emphasis on trying to eliminate the barriers that might preclude their success in the classroom. And then I'd like to introduce the Center for Violence Prevention from Pccc.
Hi, good afternoon, everyone. My name is Stephanie, and I'm the program coordinator for the Center for Violence Prevention. And I have Courtney here, who's also with me. She's our program specialist. Do you want to go ahead, Courtney? I don't know. Do you want me to go?
Sure. So the Center for Violence Prevention links the college community with education, resources, services, and supports on issues of power-based personal violence, which is an umbrella term for topics such as domestic violence, sexual assault, dating violence, and stalking. And we develop programs to prevent, educate, and raise awareness on these issues.
Yes, and just to add a little bit to what Courtney said, we do have a strong relationship with the Office of Student Advocacy because, well, when we were on campus, a lot of our events and programming for students overlapped. We collaborated a lot. Many of the students that I know Leah and Tina have seen either at some point come in contact with the Center for Violence Prevention, or we've also referred students as well to the Office of Student Advocacy, because as many of us know, when students are in violent situations, whether that is, stalking or sexual assault, a lot of outside factors are also involved in that, and then that also can obviously impact their academic well-being, their social well-being, and their mental health. So I just like to always throw that in there. Thank you.
Sorry about that. My name is Gina Tylers. I'm from Redmond Valley Community College. I'm lead mental health counselor there. And I am a licensed professional counselor, clinically certified forensic counselor. I recently became certified as a mental health integrated medicine provider and a clinically certified anxiety treatment professional. Shane, do you want to introduce yourself?
Hello, my name is Shane Redmond. I'm an academic advisor at Raritan Valley. I work in the office with Gina, and we work hand in hand with resources for counseling and, of course, advising. I have a background in counseling psychology. I was a high school guidance counselor, so I have a background in social, emotional, mental health, dealing with high school student age, and still kind of dip into that in the Raritan Valley level. I'm also about to become an LAC, so I'm verging there between advising and mental health counseling.
So at Raritan Valley, we assist with the transition from high school to college. We help with coping skills, stress, test anxiety, anxiety in general, relationship issues, mental health issues, both first break and anyone who is already diagnosed. We do assist with drug and alcohol issues depending on the type of treatment needed. If it's maintenance, I have my treatment group, I've got my AA, I've got my, I'm well connected on the outside. I may just need a touch base person. We will help with that. Otherwise, we will refer out. We do crisis assessment and referrals. We are short-term in counseling. We also work with our resource center to connect students with any financial issues, technology assistance, housing, food assistance, things like that.
I guess I also just want to, something that I forgot to mention, I'm a licensed clinical social worker, and Tina Rabato, the student advocacy specialist, is also a master's level social worker. So we bringing the similar skills to the table is I think has been really valuable to the student population. So I'll hand over to Tina about what we're seeing at PCCC.
Okay, thanks, Leah. What we've been seeing,
during this time. Like a lot of students are being affected, whether they themselves have, you know, had a family member with COVID, they've had COVID, loss of jobs, and that brings on a level of stress and anxiety. You know, they have multiple caretaking responsibilities, and what we're doing is like trying to just do the outreach and providing them with the basic necessities, any resources that they need. And, you know, again, the anxiety is at an all-time high because they're not sure what's happening. They're not sure what's going to happen if they're going to go back to school, work, family, and all of that, you know, just makes that stress level go up. You know, some people, you know, you know, they're worried about their living conditions, relationships, unemployment, you know, and I know Stephanie and Courtney have probably seen an increase with the, you know, domestic violence, because if they're in, you know, in a relationship that, you know, is not healthy, it's hard for them to get out, especially with this whole quarantine and the lockdown. Granted, things are easing up, so that's the good part. I don't know if Leah wants to add more to that, but that's what we're seeing right now.
Yes, and I just wanted to add also with what Tina said as well, that first part of the, I should say the first month or so, it really wasn't, I think, what, we really weren't getting as many reports, and I don't know if that is something that other institutions have seen. The first month has really been, the first month that we were remote, it was pretty, it was hard to engage with students. I feel like students were going through that phase where they were just focusing on trying to, you know, finish the semester. Obviously there has been many changes. So that first month we really weren't really interacting with many students, and I was honestly like a little more on the worried side. But then when I spoke with our community partner, the Passaic County Women's Center, they had also said that they had seen a decrease in reporting, and I think it also had to do with just the limited situations that many students were in. Obviously, at that point, most people were not leaving their homes, and if there was any violence going on in the home, then they were pretty much kind of stuck there and with very limited options. I want to say that we started seeing a little bit more of a shift or more student engagement and outreach, probably at some point like mid-April or so. So that definitely, and also a lot of substance abuse. Also, there was a correlation, I believe, there between that and just different situations with power-based personal violence. So we've connected students also, as aside from our community partner, we've also connected them with other agencies that can help them with, you know, substance abuse treatment, obviously through telehealth services, which was also another barrier for a few students that are already, I guess, technologically, they were not, I guess, they had to refresh their skills. So this was, and I think this is for all of us, but so that's just something I always like to highlight as well. The importance of community relationships in our, at least for the Center for Violence Prevention, since we don't offer direct counseling as Office for Student Advocacy does.
Something that I was also noticing was, you know, this situation has exacerbated stress and anxiety in all of us. But something I noticed a real uptick in quickly was the stress and anxiety directly related to academics, because of how difficult, you know, attending class became overnight for many of our students, and also just the learning style of learning virtually is something that, you know, many students struggle with. So I think that there was you know, a major uptick in anxiety related to studies, and anxiety related to not being able to study at home, you know, for a variety of reasons. So, and I spoke to many students in the beginning of March who, you know, I had existing relationships with, who were nervous about their condition declining. And then as April and May went on, it was people who I felt maybe on a normal basis would have not contacted my office, but were going through so much that they needed to talk to somebody and hear that they are not alone, and that, you know, the situation is truly unprecedented and difficult.
We were seeing the same things as you all were seeing. We definitely saw an increase in agitation and frustration because of technology, because of a different style of learning that people needed to try to, you know, get up quick on. The other thing too that I was seeing was that increase in anxiety led to an increased need for hospitalization with us. We did have one death. Unfortunately, he was not a student known to us, but he was one of our students. And, you know, we all grieved that death as well. But it was one thing that I found interesting was some of those students who we know to have anxiety actually said, welcome to our world. You know, we deal with this anxiety and this uncertainty every single day. Now people are understanding what it is that we're going through. And it was almost comforting for them. So it was interesting to see how we're responding. I'm pretty sure all of us, I know Pccc and us, we've spoken in detail. We're providing virtual office hours, existing counseling, case management, referrals, all via Zoom, drop-in office hours, virtual support groups in collaboration with ODS and Student Advocacy, SAM's social media campaign. At RV, we're also supporting faculty dealing with student issues. We do have virtual office hours, and we have a Tuesday and Thursday social circle, as well as Tualoha groups. Tualoha is a national organization that we have our university chapter at RV, and I'm able to be an advisor for that. Tualoha stands for To Write Love on Her Arms. It began, I want to say late 90s, early 2000s, and they're based out of Florida. We work case management both in and out of the RV community. We do our virtual workshops with SAM, relaxation, time management. We really try to hit everything as we can. And we have a new program at RV called STAMP that I was able to begin, students teaching and mentoring peers. These students are certified peer educators who partner with a student in need. So the student in need, just we buddy them up with someone to help get them around school, talk them down if they're feeling just a little bit anxious, maybe walk them to their car at night if security is unavailable. And it's just someone who can help that person learn the lay of the land at RV, and it's an additional support for that person. The stamper meets weekly with myself or another club advisor to go over the week's events and process any issues that rise. So the stamper is not left on their own devices. The stampee is met with by me or one of the counseling staff to make sure that they're getting the continued support that they need. And we're also utilizing social media for both outreach and resource distribution. Pccc, did you want to finish up?
Sure.
So for the, yeah, I'll go. So we're also, we're involved with the PCC CARES, the Federal CARES Act assistance, connecting student populations with support and resources during this pandemic. So they reach out to us and we've compiled a list of community resources for them that they can access, you know, in the meantime while they're waiting for their application to be reviewed. And we also provide, you know, one-to-one contact with the applicants. We follow up with them if they're ineligible with any additional supports. You know, that list that I mentioned, that's part of it. and then in any other way, we will try to support them for their specific needs. Observation of a correlation between the need for community resources and experiences of power-based personal violence. I don't know if Stephanie wants to talk more about that.
Yes, so I guess one of the pros definitely of having student advocacy and the Center for Violence Prevention pretty much monitoring and helping students, or I should say being one of the main sources of contact for students applying for PCC cares, has pretty much been that in some way or form, and I don't know if I'm saying it correctly, it's almost been like another referral source for us. So in most cases, prior to COVID, a lot of student referrals were given to us or sent to us by faculty, by staff, or even some students that referred other students and other peers to us because they felt that we've helped them, or at least we've connected them with resources that could help them. So definitely being on the front lines, even if it's obviously through email, we were able to, I want to say, observe and at the same time almost intervene if necessary with students when maybe at first they were contacting us for the CARES funding, but then upon further conversation or more diving into their specific needs, other underlying issues have come about, such as violence in the home, or such as a family member, an immediate family member being in a violent situation that has pretty much affected the student as well. I've seen a lot of that, as well as just students who are parents, so they also wear multiple hats. Hence, one of our virtual initiatives was that we started a essential workers support group, and also it's for the essential workers, students who are essential workers, but as well as students who live with essential workers, which I think is a population that sometimes gets maybe, I don't want to say forgotten, but maybe a little lost, because I know a lot of the focus, whether it's in the community or in the media, has been on essential workers. Because of course they go through their own challenges during this time. Their loved ones have also been very impacted, and I'm pretty sure Leah, I know, we've spoken about that as well, how many students that have parents that probably were essential workers, and then also involved with, financial challenges, as well as just maybe even dealing with a family or a member of the household that was infected with COVID. And then how do you quarantine? And then how do you stay with, how do you stay academically engaged, or even engaged with, your school for that matter. So that has been definitely some of, at least my observations that I've seen being interacting with students through the PCC cares. And I think that, and definitely I think our comprehensive list of resources has also helped at least students in the meantime while they had to wait for the funding. I don't know if Leah wants that.
The resource lists and directories that we have developed and distributed, specifically for our county, because we're located in Passaic County, I think have really been integral for a lot of our students, because a big mission of student advocacy prior to COVID was linkage to community resources, so that these barriers could be addressed and obstacles could be overcome. And then this coronavirus occurred, and it really threw everyone for a loop. So these resources, a lot of students would say to me and to Tina regularly that they had no idea these community agencies and resources existed. So that's been a really integral part, just distributing useful and meaningful information in a succinct way. And we've also done so through our campus's food insecurity initiative. We've used those databases to distribute meaningful information regularly. And additionally, we've targeted campus groups, big, student organizations, and kind of just sent sort of like a, sort of just information to them, directories to them. For example, EOF, our TRIO program, we have several large student groups, our honor society, our different student initiatives, as well as student government. We've made sure that we regularly kind of plug this into our communication with them. We've also developed a little bit of a web presence that while it's not much, it's something that students can look at. It's called the Stress-Free Zone, and they can just view it. And it's quiet meditations, music, imagery, videos, things that they can take refuge in, especially if they're spending a lot of time behind the computer, completely non-news related. But I found that when I've, kind of directed somebody towards that resource, they really appreciated it.
So RV is working with our community partners, and we're really lucky that we have a close working relationship with them. So the transition for us, although it was difficult all across the board, it was easy for us because it was a quick pickup. Hey, Amy from High Focus, it's Gina from RV, how's it going? I need to connect you with a student. Great, send them over, let's get it connected. So it was working out really well. And of course, not just High Focus, but a number of our other community providers. Like I said earlier, we work directly with the Resource Center to help support the students who need additional support, food, housing, financial, or other emergency and long-term resources. We do connect them with medical connections as well for Zuful or Zarephath. And we also connect them with Rutgers Dental School for families who have dental needs. So with all of that connection and us working so diligently and so hard to get everything together, we need to start to take a look and see what's going on for everyone, including ourselves. Go ahead, Leah.
Uncertainty.
Yeah.
I think kind of really the crux of this workshop is sort of the uncertainty that we're all going through, and the uncertainty that surely our students are going through, and just acknowledging that it's not easy for anyone. If I had $1 for every single time I told a student on the phone that it's okay not to be okay today or tomorrow, I don't know. But it was something that still is something that I'm finding myself say very frequently and reminding myself of that. So I think that this is an important time for us to, as the professionals, as those advising, teaching, working in student services, to remember that it's okay if we don't feel okay, and if we want to be models of how to be compassionate to ourselves, it starts with us. And if one of the big points that's really important to drive home to the student is the whole idea of expectation management. Things are not going to be like they were prior to March. And even if for our already anxious population and for our population that is going through the situational anxiety, we want to hold on to something. We want something concrete. We want to know what it looks like, and this not knowing is very frustrating. So teaching our students to be compassionate to themselves, to just try their hardest, and if that's different than what it was when they were in the classroom traditionally. And also that it's sometimes you have to manage your expectations. Sometimes, having the expectation that you'd be able to handle 5 classes, well, maybe not this time. Maybe you want to scale back, or maybe, you just passing was good. You should, be proud of yourself. So I always try to help the students reframe what they assign negativity towards as you made it over an obstacle. Maybe it wasn't as pretty as you wanted. Maybe it wasn't as maybe it didn't appear like it did last semester, but you overcame a really big obstacle and you're still whole on the other side of it. So, you know, reframing that is really, it's seemingly a very simple statement, but it's sometimes not the easiest thing.
So as we talk to our students about reframing things and understanding that things are different, we've got to realize that we need to pay attention to that for ourselves too. So we push self-care to our students. We need to make sure that we take care of ourselves. So take time for yourself. I know sometimes it's a lot easier said than done, but we have to do the best we can to keep that separation from work and home life. It's so easy to get caught up in work life, especially when you're working from home. You're right there at your desk constantly. There is no separation. There's no drive time to help you wind down. Find ways to make sure that you can take that time to wind down and get away and step away. It's going to be definitely so important, and we need to recharge. And that's why I liked the little cut out, the little cartoon thing there. It says you can't pour from an empty cup. Take care of yourself first. So you got to fill your cup in order to be able to share what you have with other people. And we need to realize, as much as we tell other students, know when to say when, we need to know when to tap out and say, I need a break. I need time for myself to just unwind and relax and walk away.
So I'm just going to piggyback off of what Gina said. You know, work-life balance. Life requires balance, and right now it's definitely more challenging because, you know, everything has merged. Home life and work life, it's together, and it's very hard to separate the two. So it's important, you know, to make boundaries. You know, you could set your laptop up, you can be on it all day, but make sure you take the time to eat. You know, eat lunch, eat a snack. Try to make a regular schedule as much as you possibly can. You know, and then when your work is over, it's over. Then you have time, you know, for yourself. You can do things like reading, cooking. You have time for your family. And if you're feeling particularly stressed, you can consider some relaxation techniques. You can watch TV. If that's something that makes you feel at ease, do that. Go for a walk. Read a book, like I said. Anything that helps you to relax and to separate your work life from your home life. And if you have a family that you're taking care of, you want to be sure that you can devote some of your time to them while you're not working, so that you can, you know, give yourself 100% to work and give yourself 100% to your loved ones. You know, that goes with putting away your work for the day. Shut it off, close it, and then just, you know, if you are stressed, like I mentioned before, you know, do something that will help you. Yoga helps, meditation, walking exercises. Breathing exercises have been shown to relieve some anxiety and promote positive well-being. And with that, I will pass it on to Shane because he will talk more about that.
Thank you, Tina. So exactly going off of what Tina just had said. So aside from the population that we've all been working with for a very long time, that's been dealing with a lot of mental health issues, which include obviously depression, anxiety, all kinds of stress management issues, managing them. We have a new population, obviously, that has come up now that is never before apparently been susceptible to mental health issues. And now we have another population on top of our old population that we're still working with that are also now experiencing many of the symptoms that people that have been susceptible to with mental health issues for a very long time. Going off of what Tina had just said, there is a particular breathing exercise that is known to be a change system in the physiological system of the human body, the parasympathetic breathing has been able to reduce that stress, reduce that fatigue, and help people better manage stress. So as much as there's so many things out of our control right now in this world, one thing that we can do is we can kind of help our physiological beings by changing the way our systems react to what is happening on a daily basis and how we are processing it into very negative thoughts and feelings. So the breathing exercise, it comes from yoga. So if any of you out there are yoga enthusiasts, I'm not, but I should be. The 4-7-8 breathing exercise is something that is so easy to do, and you can almost feel the benefits right away. Most people do. I feel it right away, and I've been doing it for a little while now. But after a while, this can be something that your body learns, and it's a lot easier as you go along. What I also recommend, since we work with so many people that are almost in a constant 7 or 8 on the scale of 1 to 10 in that anxious state, or they're just feeling out of control in other physiological ways, I would recommend telling the students to try to do this exercise when they're actually feeling better than worse. Meaning when you have an anxiety attack, it's very hard, if anyone out there has had anxiety before, which according to statistics, probably most of you who I'm talking to, it's very hard to do something like this when you're in that fight or flight mode. And it's better to start doing this now, to be proactive, kind of when you wake up and when you go to bed at night. So it's a matter of doing it twice a day. We're talking 2 minutes of your life in the morning, 2 minutes of your life in the evening. And I think all of the students and even staff and everyone else that's going through this can feel the benefits right away. So ideally, you want to sit with your back straight up. You can do it standing up. You can do it if you're in a, somewhere where you kind of just are feeling that crunch. But ideally, yes, you could sit just like you're sitting right now in a chair. You would put the tip of your tongue very lightly right behind your 2 teeth on your roof of your mouth, barely so it's touching. You don't have to press it or anything. And you want to breathe in quietly with your nose. You'll take 4 seconds in with your nose, and you'll hold it for 7 seconds, and then you'll reduce, and then you will blow out forcefully. So again, in real quiet, like you're trying to keep it a secret, if that helps, and then blow it out like you want everyone in the immediate area to know that you're doing it, while keeping your lip loosely pressed on your roof of your mouth, right behind the 2 front teeth. It may seem awkward in the beginning, and you may even feel a little lightheaded. That's okay. That is all healthy changing of the sympathetic. Excuse me. So I'm going to give a demonstration, and I also just want to let you know, everyone's going to get a copy of this PowerPoint, correct, Leah, Gina? Yes?
Yes.
So there's also a very short 5-minute video by Dr. Andrew Weil, who really promotes this 4-7-8 breathing, because it happens to be one of the easier breathing techniques with more effective results. So I'm going to give a demonstration. And you want to do 4 cycles every time. So if you're doing it twice a day, you can do it more than twice a day. But twice a day is a great start for the first couple of weeks. You want to do 4 cycles, no more, because you don't want to overdo it, and you don't want to get to the point where you feel it's a real burden to do it. So 4 cycles is the perfect physiological amount. So you'll go. That's it. That's 4 cycles. That did not take a lot. And I actually feel a little like that runner's high almost bit, the endorphins a little bit, and definitely feel a lot calmer. You can hear my voice. I'm kind of like a little more relaxed than I was a minute ago. And that's it. That is the technique. And of all the things that are out of control in this world, this has been physiologically, scientifically proven to help someone. And again, the more you practice it, and you do have an event where you have an anxiety attack, a panic issue, or you're just feeling completely out of control and you're trying to manage stress, you're having a terrible day, yeah, then it's a lot easier to revert to this and just to kick your system into doing it. So again, there's a video, it's about 5 minutes long, and it hopefully I explained it and demonstrated it just as good as Dr. Wheel, although he is more of the master at it. So thank you.
So definitely try the breathing exercises. In a nutshell, what it does, it increases your oxygen, it decreases the cortisol level, and it gets everything flowing the right way. So some things to remember from our presentation: it's okay to not be okay. I can see, you can say things like, I can see this is hard for you. Please know we're here for you. And we too are frustrated and uncertain. It's okay to be honest with people. Don't just say, oh no, I got this, it's fine, it's up. No, acknowledge our own issues and our own difficulties that we're having, and know that we're struggling sometimes, and it's okay to do that. Help people understand you are not responsible for what you cannot control. I think that's one thing that is happening in this uncertain time, is we keep thinking there are things that we have to control. There's nothing that we can do except what we know we can do to keep our family and ourselves as safe as possible. And that's what we have to hold on to. Think of a struggle in your life that you overcame, and then tap into those tools that you use to do so. Realize you are stronger than you are aware. Summary wrap up. Everyone is seeing an increase in anxiety. Everyone is seeing an increase in mental health issues, agitation, depression, suicidal ideation. Domestic violence incidents are on the rise. Drug and alcohol issues are on the rise. How we are responding: virtual office hours, almost business as usual lately. Drop-in office hours, virtual support groups, case management within our community college and outside resources, and connections to those community providers and resources for continued support financially, housing, food banks, things like that. Make sure that you indulge, and I say indulge on purpose, in self-care, because it is important. There's a reason that on an airplane they say put your mask on first. Take the time you need to recenter yourself and relieve the added stresses of the day. Recenter so you can get recharged and do the other half of your day. Spend the time with your family because they need you. Try the breathing exercises that we did here, or find one that you do like. There are a number of applications for breathing exercises and meditations. They're all really good. We may have to physically distance, but that doesn't mean that we have to isolate. Stay connected with friends and family. Get on social media with people. Do FaceTime. Get on Zoom calls. You know, Microsoft Teams, whatever it is. Stay connected with people. And remember, by working together, the storm will pass. So I'm going to stop sharing my screen and we can open it up for questions and answers.
Thank you, everybody. That was terrific. Thank you so much for sharing your insights, tips, tools, breathing exercises, ideas to pair students with mentors and other ideas. Very informative. I appreciate it. I'm sure everybody else on the line appreciates it as well. Does anyone have any questions or comments before I start scrolling through the chat to take a look?
I think just say thank you to everyone. And I also want to thank everyone for just reminding those of us who are listening that well, we're so busy taking care of others, we need to remember to take care of us. And I will remember that visual of the empty glass. So I really appreciate you sharing that and reminding us. Well done.
Thank you.
Thank you.
So Doreen Pontius shared that the HR department at her institution started a walking challenge, and the staff has been participating virtually. That's a great idea. And one of the other questions was already addressed, so no need to repeat it. Any other questions? And if not any, and if no additional questions, would anyone like to share any additional practices or guidance or ideas that they've implemented at their institution that might be helpful to all of us on the line, or for the folks who will watch this asynchronously? Well said. Well, okay, so what we'll do, if you haven't done so, before you log out, please enter your name, college, and email in the chat. And, oh, here's a question. Here we go. Good. How would you address that some of the students might be zoomed out? And how do we find ways to support students who are zoomed out? And if I may take the liberty and just ask an additional question, would you offer similar advice, not just to students, but to those of us also, all of us who are using Zoom or WebEx or whatever technology it is? What advice would you offer for students who might be coming to you, sharing that they're zoomed out, and for your colleagues, all of us who may be a bit zoomed out as well?
I've heard this one a lot, about just feeling really like zoomed out, overwhelmed by the amount of zooming that needs to occur, and you know, just craving actual interaction. You know, so I think it's a really, it's widespread, it's legitimate. And I can be honest with you, I feel this way from time to time as well. I always recommend that they try to structure their day, like try to set up their day like they are not at home. So like put in a time for when I'm going to eat breakfast, put in a time for when I have my class. After that class, if I can, get up, take a walk, get up, get away from it. Just try to distract your mind, give your body something else to do, you know, change the scenery up a little bit. It's easier now than it was in April. If you guys all remember April, it was the coldest April I think I've ever experienced. But you know, giving them, setting a sense of structure so you don't feel like you just lost an entire 24 hours in front of the computer. You know, so taking control in that sense. And brief distractions, I think, are really helpful. I always recommend taking a walk. I think exercise is a real huge healer of us as people. But if they have, like, you know, something else they enjoy to do that's not tech-based, so like writing, drawing, coloring, a crossword puzzle, sitting quietly listening to nice music, and working those into their day kind of helps combat the zooming out.
One thing I try to tell people is make sure you see people in person, because, you know, we forget sometimes that that's important too. So get out there with people. Of course, keep the physical distance. You don't want to get sick, but you do want to see people. There is that interaction, person to person. It does a lot of good. And then once you're able to get away and then you have to come back to get onto more Zoom calls, it's actually okay, because you're connecting, you know, having that human interaction.
I also just wanted to add as well, like, I've heard many creative suggestions, now that Gina mentioned about actually seeing, you know, friends or coworkers or classmates. I've had a student tell me that they went on a on a picnic, but they were basically in their trunk. And then another student was in her car, and, you know, they maintained obviously the 6 feet, and they were talking, and they went to a park, and they said, and she was just like ecstatic, like saying that that was the first time she had seen any friend like in person in like almost 2 months. So something like that. I don't know. I've just heard many suggestions, and kind of just piggyback what everyone is saying. I'm pretty sure all of us, being that we at some point have to Zoom for work, we are already Zoomed out. So then definitely what Leah said too, just kind of even putting the computer down and working on a project or something, and then maybe saving it for the end of the week, having like a check-in. I know I do that myself with my friends. And, you know, we talk about, I don't know, a book that we read that week, or just something that we actually physically did versus just having the Zoom itself. So that's always, you know, it's always obviously, it can be, I guess, played with whatever you are interested in, that I guess in an individual's interests. So that's always good.
It's great. Thank you. Okay. So we're almost up against it. We have a few more minutes. Anyone have anything to add before we call it a Zoom webinar? So like I mentioned, please enter your email address in the chat, and we'll send out the resource guide that our colleagues put together for everyone. We'll also send you the link to the webinar recording and a PDF of the slides. And other than all that, thank you all for being with us this afternoon. Thank you to our presenters for doing such a wonderful job. And everyone have a great weekend, and we'll see you again real soon. One last reminder, we're going to do the last of these next week at 3 on parent and family outreach in the student services space. So you're welcome to join us. We have 500 seats. We have more than enough space for everybody at the community colleges who'd like to be a part of this. Next Thursday at 3. So thank you all. And if you have any questions, you can reach out to me. You can reach out to any of our presenters, I'm sure. We'll send this all out once we have the webinar recording. So thanks again. Have a great weekend. Keith, great to see you, my friend.
Good to see you as always. Thank the presenters. You guys were real.
Thank you.
Thank you, everyone.
Thank you so much.
Guys, great job.
Bye-bye.
See you, Jake.